Hello everyone, welcome to my channel MedText. Today we are going to study about thrombosis and embolism. First of all, let's get started. What is meant by thrombus? Thrombus is a clotted mass of blood, and the formation of this thrombus is called as thrombosis. In some cases, the thrombi can break and it can form an embolus. And this embolus can grow all the way and can cause and can sit at a small vessel. And this is called as thromboembolism. Now, the thrombus formation can include three causes. It can be due to endothelial injury, as a result of endothelial injury by any biological or traumatic or chemical agents, there is injury of endothelium. Now, as a result, there will be exposure of collagen. This will activate the platelet cells, or also called as thrombocytes, to come and aggregate. This will form platelet plug, and will further coagulate blood. So this is first cause. The second cause include slowing of blood flow, normally the blood flow is laminar, right? When it becomes turbulent, the blood cells come mostly of the platelets, right? The platelets come and they aggregate in the endothelial layer. So as a result, this will lead to a thrombus formation that will cause hypoxia. What is hypoxia? As a result of blockage here, the part of tissue later on will not receive oxygen and it will become hypoxic. Later there will be cell death or necrosis. The one more reason for development of thrombus can be from increased blood coagulation. As a result of anticoagulant lack or deficit. So these are the three reasons of thrombus formation. Now, as a result, thrombus is formed. It can break, rupture, and can cause embolus that will go and it will enter the small vessels of the blood stream and will cause occlusion there. So now let's move on to embolism. Here, embolism, it is the passage of solid, liquid, or gaseous mass through the bloodstream to a site distinct from its point of origin. You are understanding, right? Now, there are some types of embolism. Let's get through them and understand them in detail. They are mainly of two types. First one is exogenous and second one obviously endogenous. Now what comes inside this exogenous and endogenous is what makes it different. So the first one in exogenous type is due to air embolism. Air embolism is caused in certain situations like jugular vein damage or air injections. What do we mean by air injection? Like when injection is given, so the syringe has to be taken out, like some liquid has to be taken out from there, or else the air bubbles will form inside your veins and it will cause air embolism thereby. So another example can be open heart surgery. The next type of exogenous embolism can be gas embolism. Now most of the time students confuse between air embolism and gas embolism. Both seems to be one, right? But there's a lot of difference. Now for gas embolism, it can be in certain situations like diving people. You know the divers, right? They go inside the pool, and as the depth increases, the oxygen compensation for the gases will increase. So as a result, there will be buildup of oxygen, carbon dioxide, and certain gases like nitrogen. And as a result of this buildup, this nitrogen will dissolve in the blood, tissue, and fat, and it will cause certain consequences like confusion, dyspnea, and later it will lead to trouble of speak and double vision too. So let's continue with another example of gas embolism that can be due to air pressurization in planes. Most of you might have experienced it, right? So that is due to gas embolism. Right. Moving on further. Another type of exogenous embolism include is the second one, and moving on to the third one. There is due to microbial embolism. It can be due to a parasite or fungi or protozoa. Right. So these are all our exogenous embolism. Moving on further to the endogenous type. In the endogenous, we have two most important types, that is fat embolism and tissue embolism, which I'll tell later on. So in the fat embolism, it can be caused due to oil intravenous injection, long tubular bone fractures. As a result of bone fracture, like suppose there's a fracture over here, the surrounding adipose tissue, this will swell, and as a result this here is a blood vessel flowing on, so this will cause its entry into the blood vessel and will cause fat embolism. So this is the mechanism of long tubular bone fracture. Alright, moving on further to the tissue embolism. In the tissue embolism, it is mainly due to tumor metastasis or can be bone particles. Pay attention here. Here it is the adipose tissue which is being involved, whereas here it's the bone particles. The other example is found to be the fragments of atheromatous plaque. Now what is this atheromatous plaque? During formation of atherosclerosis, like there is a blockage of blood vessel due to atheroma formation, and this rupture can lead to fragments of atheromatous plaques. This rupture can cause tissue embolism thereby. Okay, moving on further. Alright, now we will discuss about the embolism, where it ends, emboli, and what it causes. Alright, so in arteries, it will lead to ischemia, whereas in veins, it will cause venous hyperemia. These topics we will deal a little later. What does ischemia mean? It means the inadequate blood supply to an organ. So as a result of occlusion in arteries, there is inadequate blood supply to an organ, and it will cause ischemia. Later on, what does venous hyperemia mean? Venous hyperemia is an increase of organ or tissue blood volume due to inadequate venous blood flow. Now, in venous hyperemia, the skin tends to be pale in color or cyanotic. That means bluish, and the temperature will drop. Let's continue. The thrombi can cause occlusion wherever, right? So for example, if it is taken in the right part of heart, it will go and embolize in the pulmonary artery. Pulmonary artery embolism can cause hemorrhagic infarction of lung, sudden death due to acute respiratory failure, and it can lead to bronchospasm. Alright, the next consequence is if the thrombi takes in the left part of heart, it will go and embolize in the cerebral artery. The most common part of thrombi involvement is in the deep leg veins. This will go and stop in the lungs. Alright. Another part. The venous thrombi of gastrointestinal tract will go and embolize where? In the portal venous system. Alright, so these are the most common parts where the thrombi can go and embolize. Alright, so this is the session for today. Thank you so much. Please hit a thumbs up, like and subscribe my channel for more updates. Thank you.